Vino Lion Media presents Business First.
Hi, all, and welcome to a new edition of Business First with Sonia Aline. I am your host, and today we are talking to someone who has carved out a very special and important niche in healthcare. Healthcare, as you know, has and continues to be one of the fastest growing industries. In fact, according to the Bureau of Labor Statistics, 5 out of the 20 fastest growing industries through 2029 are in healthcare and social services. And this gentleman in his company, which he co-founded, called Independent Medical Group, gets to check off both of those boxes. And so we welcome Steve Vixamar. Steve, how are you?
I'm great. Thank you so much.
Good. So I want to let the audience know that you've co-founded this company with your partner, Clifford Knights.
Correct. Clifford and I have been business partners for about 20 years now. So yeah, we started this company together back in 2014, but we've been business partners.
Oh, I was going to say, like, how old were you when you became business partners 20 years ago? Okay.
Yeah. Actually, I was maybe 16 to 17 years old. We were in high school, and how we got started is really being in class. And I remember Cliff needing to make like a car payment. And I'm like, hey, listen, let's throw parties. Let's throw a party to help raise them and get the money to make your car payment. So our first company was CNS Promotions, Cliff and Steve Promotions in high school. And it just started out of, just trying to make his car payment. You know what I mean? So that way we can, make his car payment. So we started throwing parties. And that's kind of how we got started. And that was like our first.
Wow. So have you ever worked for anyone, or did you just start off as an entrepreneurial soul and that's what it's been?
You know what? Ever since I was a kid, I had kind of an entrepreneur spirit. Being of immigrant parents, they've always had that entrepreneur spirit. So I've always, like sold cakes and sold candy and stuff in school. So I kind of always had the entrepreneur spirit. I did have a few jobs growing up. I worked at, McDonald's in high school. I think everybody kind of started at a fast food, chain. I might have had one call center job. But in between then, me and Cliff has always had our own business.
Well, and also coming from immigrant parents, I'm sure that the encouragement was to be either a doctor or an attorney or an engineer. So how did you convince your parents that, no, I think I'm going to figure this out on my own?
Yeah, you know what? As a kid, I always wanted to be a doctor because I always felt as if being a doctor would give me the opportunity to provide and help more. So yeah, I've always had that push from my parents that, hey, you need to become a doctor or a lawyer or, something stable. I think that for them, the few ups and downs that we had, luckily for Cliff and I, when we started in high school throwing parties, we were able to have some rather quick successes. So I think that they saw the ambition in us and were like, okay, I see that you guys, threw a party, back then, this is 98, 99. So if we threw a party and made $10,000, we thought we were rich. So for my parents then, they were like, okay, they kind of seen some of the ambition that we had. So they just kind of allow us to, to do what we wanted to do. But yeah, it was challenging.
Wow, I can imagine. But you all work well. You two work well together, obviously, because this is a 20-year, not only friendship, but business relationship. And now you've started this really important, I'm excited for you to tell our audience about your company, Independent Medical Group. Tell us a little bit about you.
Yes. So Independent Medical Group is a specialty healthcare clinic. We do testing for HIV, hepatitis C, and STDs, primarily in the underserved community here in South Florida. We are planning to go nationwide, but today we have 8 brick and mortar clinics and 12 mobile clinics that span the state of Florida. And we primarily go to the underserved community to provide healthcare.
Okay. And so what inspired that idea?
So back to Cliff and I, we like a lot of people call us Pinky in the Brain because Cliff has all of these great ideas and I'm more of the operational guy. So I think of, okay, here's what we're trying to do. And then trying to figure out the blueprint and the roadmap to get us there. So we started in high school throwing parties, and the club owner that we threw parties at actually owned a specialty pharmacy that was servicing HIV patients down in Liberty City and some of the underserved communities here in Miami. So when I first started, I would do the deliveries, delivering the medication, to these patients. And then Clifford came on board, and I went from doing the deliveries. I became a pharmacy technician. Once we graduated high school, I started going to college and studied business. So then I started doing like some of the marketing and business development for the pharmacy. So I spent about 2 years learning a lot about pharmacy, learning a lot about the underserved community and HIV, and realizing, again, the healthcare disparities in the Black and brown community, especially when it came to HIV, and just a lot of the stigma that was associated around it. We would have to deliver the medication in like brown paper bags because people wanted to be discreet. So it was a lot of these things and just lack of knowledge and education of HIV. So doing that for a few years, we had the pharmacy. At that point, that pharmacy sold to Eckerd's. And for those that probably just tells my age there. So that pharmacy sold to Eckerd's. And once they sold to Eckerd's, Cliff and I, because we knew all of the patients and all of the doctors, we decided, you know what, let's go ahead and open up our own pharmacy because we knew that the big box store would not cater to the patients the way we would. They wouldn't want to deliver the medication. They wouldn't help them with some of the social economic needs and things of that sort. So that's kind of what got us into the HIV specialty space. Granted, I'm not a doctor. Okay. Cliff's not a doctor.
All right. Yeah. So I want to back up just a little bit. So what made you, so you had dealt with this pharmacy for about 2 years and you were doing a lot of relational stuff. You had taken a couple of classes, so you understood marketing. But what made you think that you could open up a pharmacy?
I don't know. I just think that just coming from where we come from, taking risk, I guess, understanding the couple of years that I spent there and understanding the need of the community and kind of realizing that no one else was going to do it. It was really just out of need and necessity, right? And compassion for the people that we were already kind of servicing. And that was the first time that I realized that healthcare was more economics than health. Because when Eckerd's bought the pharmacy from us, and I hate to say the name like I'm talking bad about this corporation, but when they bought the pharmacy, our mandate, our mission when we had this pharmacy was to service the underserved, right? So we would deliver medication at about, 20, 30 mile circumference. It didn't matter where the patient was. We were going to get your medication to you because we know that you didn't have transportation. And that, you didn't have some of these resources to get to the pharmacy, to get to the doctor. So we tried to make it as convenient as possible. And this is back in 99. So when Eckerd's bought the pharmacy, they purchased the patient base and the revenue, but they didn't care about trying to service that community. And I get it. I mean, they're a big corporation, logistically, it didn't make sense for them. Those big box stores, their whole motto is they want you to come to the store because they want you to buy the $10 toothpaste. So at that moment is when we realized, like, wait, yes, they sold the store. So who's going to take care of our patients? Who's going to take care of these people that, we've been servicing for all these years? And I think that's when we were like, you know what? We got to figure out a way to get our own pharmacy back in the community because if we don't do it, no one else will. So that's kind of what drove us to do it. It was kind of out of necessity for the people.
So what did the first part of your business actually look like?
It was a long road, right? Because again, being that Cliff and I are not doctors, we're not pharmacists. So trying to understand the landscape. Okay, so how do we open up a pharmacy if we're not professionals? The good thing that we did learn from working with that previous pharmacy is that gentleman wasn't a pharmacist either. He was a businessman. He had a pharmacist as a partner and he hired pharmacists. So I knew very quickly that, okay, this can be done. I don't necessarily need to be a pharmacist. I just need to find a pharmacist that has the same goal and mission that we had. And that's what we had to do. We had to find a pharmacist that understood what we were doing. The time frame to get a pharmacy open and get it, at least just the licensure, takes about 6 to 9 months. So we had to take some time and had to find somebody who believed in what we were doing, that was willing to kind of sacrifice with us. I mean, there was many dollar menu nights and days, and my wife kind of understanding the struggle. But yeah, having somebody who kind of believed in putting your money kind of where your mouth is. So Cliff and I just worked as much as we could and saved up every dollar and ate Wendy's dollar menu for months to try to to get the pharmacy up and running. So that's kind of how we was able to
And so what is it that makes the services that you offer to the community? What is it that makes it so unique?
So fast forward to 2014, Cliff and I had, many of experiences in the pharmacy space. And in the pharmacy space, when you're servicing the underserved community, unfortunately, there are, legal parameters in regards to what you can provide, right? Which is silly because I'm giving someone medication and I'm telling them take it with food, but yet they have no money to buy food, right? But then I can't give them any food. So we realized there was some challenges.
And so legally you can't do that, right?
Okay. You cannot do that. Because then it seems what they call inducement is as if I'm paying this person to come to my pharmacy. So fast forward to 2014, we had our stints in pharmacy. Our lawyer was like, hey, listen, one of the best ways in order for you guys to continue providing for the community is if you guys actually own the clinic yourself. Own the clinic and service these patients on that side as opposed to the pharmacy side, then you're able to provide more. There's certain designations you're able to get. One of the things we're able to get was a designation from the CDC and the Department of Health in order for us to go out and provide some of these services. So all of the services we provide are absolutely free. One of the differentiators for what we do is we actually bring the services to the community. If you understand the Black and brown and underserved communities, some of the social economic issues that they face is obviously finances, transportation, and these things. So hence the reason why we have more mobile units than brick and mortar, because our mobile clinics will go into the community and test the patients and test the customers there. So the biggest differentiator for us is the fact that we bring the services to the people and we take care of the people that no one really wants to take care of. Unfortunately, the Black and brown community, underserved community, are some of the most difficult as it relates to compliance and adherence, right? Because you and I both, when we go to the doctor, if you have a stomach ache or antibiotic, you never finish a medication regimen. You take 2 or 3, you start feeling better, like, oh, okay, I don't need this. So you got to figure if someone is homeless or transient or substance abuse, they definitely are not compliant with their HIV or their hepatitis C or any of that stuff. So just kind of reassuring them and constantly being there, letting them know that you actually care and bringing the services to them is one of the biggest differentiators.
And so one of the things too that you've done really well is you've managed the stigma around these diseases, right, but also you provide great privacy for people as well. So tell us a little bit about, like, when your mobile unit shows up, how you even bring people in to get the testing and to get the services.
Right. One of the biggest challenges with HIV, obviously, is the stigma, right? And stigma is really just lack of education and knowledge, not really understanding HIV and how it's contracted and things of that sort. So for us, one of the things that we do when we go out in the community is we just offer free medical screening. So most of us in the Black and brown community, we're always, eager to find out about our cholesterol, our diabetes, some of the kind of common things that we know of, right? So typically when we go out, we tell people, hey, we're going to do free medical screenings, and people are really more willing to come and get tested when they know that you're just doing a general medical screening. Once they get into the mobile unit or once they get into the clinic is when we kind of start talking to them about sexual health and the different things. And if they're at risk, we start talking to them about their risk factors, because if you're homeless, or if you're a substance abuse, if you're transient, if you have a certain risky lifestyle, you're at risk for catching HIV or STD or even Hep C for that matter. So that's how we kind of get the conversation going. So we don't plaster our mobile units with HIV. We don't do any of that. Granted, December is World AIDS Awareness Month, and tomorrow's World AIDS Day. So days like those days, we're out and we're talking to the community about HIV and AIDS. On a day-to-day, we try not to talk about it as much until you're in the privacy of a conversation with a doctor or with one of our medical assistants. Then we start talking about HIV.
So I imagine you get a lot of engagement, far more than you did with the first pharmacy that you worked with.
Correct.
Can you talk to us about, like, what you've seen and the type of engagement you have and how people relate to you?
Yeah, I realized that very quickly that helping with the social economic needs, people are more receptive to getting healthcare. So the engagement in getting the community involved is great, right? Because the fact that we're always out there, we're providing, so they know that it's not just a economic and financial thing for us. Again, all of the healthcare services we provide are absolutely free. It's free to get tested. You don't have insurance. It doesn't matter. We help you get insurance. So I think that being able to be accepting of all is what helps us get that engagement with the community. We're not, the ones that are trying to shine people away if you don't have insurance, or if you don't look a certain way. We don't really, to us, it's kind of come on, come all. Cliff likes to always say the money's kind of in the dirt for him. He always says that. He's like, listen, we got to go to the places where nobody else wants to go. So that homeless shelter, we're going to go there, provide healthcare services to the people. Oh, those guys under the bridge, we're going to go there, build our mobile unit out, and we're going to provide services for them under the bridge. So I think the engagement is because we're willing to go into those places where most people won't go. So that's why the community embraces us.
Wow. And so what do you think you've learned about, there's some obvious things just in you sharing your story, but what were some of the things that you actually learned about healthcare disparities, what people need, and what's possible, like what we could do better as a society, as a community, to make sure that more people are included in our healthcare system?
Yeah, I think there needs to be a more organized, resource center and opportunity for people, right? Because our healthcare system is so compartmentalized, right? You can even, I don't want to get down the COVID path, but you can even see kind of with COVID, right? It's like, yeah, there's, rules and regulations for the elderly or for the, middle age, and then for pediatrics. So it's like, it's not all uniform, I guess to say. So it's very compartmentalized, right? So with HIV, it's even different. You can even see it down to the marketing and the advertisement for HIV. You can see that a lot of it is directed to a certain community, right? To me, I feel as if you're going to provide services, you need to be able to take care of that entire patient. So if a patient comes into a health system, you need to understand, hey, I need to provide primary care. And if you need specialty like HIV and hepatitis C, you need to be able to provide that. If that person has social economic issues, you need to be able to provide them a resource with that. It's hard for someone to worry about their health if their life is in shambles, right? So being able to have resources and make sure that they all work together is one of the biggest challenges, I think, in our healthcare system. One of the things that Cliff and I try to do is try to provide as many of those ancillary services as we possibly can, at least for the modalities that we deal with. So I know that if I'm going to an underserved community and I'm going to mental health and substance abuse places, they're probably going to have mental health issues. They're probably going to have substance abuse issues. So I need to make sure I find those resources that I can send them to help them while I'm providing the medical need for HIV and hepatitis C. So having kind of like that full array of services is, I think, is the best route. And is one of the things that I've learned is like, oh, okay, like it's really compartmentalized. Like you'll go one place with one thing and then they'll send you somewhere else. And it's difficult for people to try to get a full healthcare service if you're kind of getting sent all over the place.
Right,
you know
right.
I mean?
Your story is really inspiring for a number of reasons. And one of them is that, and we talked about this a little earlier, you don't have a healthcare background and you don't really have an entrepreneurial background, right? Like you did some things as a teenager and they worked out and they encouraged you, right? And so when you think about people who decide as an adult that they're going to be entrepreneurs, they feel like I need to go get a degree, or I need to go study something, or I need to get a mentor. And so what would you advise for someone who's listening to you, who is just like, wow, like these guys did it and they didn't have X, Y, and Z? What are some of the skills? What would you say, like your skills, talents, even your passions? Like what were some of the things that you think really do contribute to your success in this business?
So not having entrepreneurial or, medical background. So like I said, being the kid of immigrants, I seen my mom, my grandma, they've always had that entrepreneur spirit. I mean, like I'm Haitian for background. And I think that any Caribbean parent had a stint of where they were buying goods and shipping it back to their country. And they're kind of doing that, or either had a corner store, so I've had entrepreneurs in my family, none, that was, uber successful, but all of them were willing to take risk, put it that way. So I think that taking risk is kind of something that was kind of ingrained in us. So for me, what drove me to become an entrepreneur was that first stint that I had at the pharmacy, kind of understanding like, okay, in order to do this is really just understanding and educating myself in how to execute and believing that that I can do it, I guess. I'd rather take the risk on myself than working at a company. I remember one company that Cliff and I did work for about 6 months. I remember thinking that, it was December, and I don't want to say the name of the company, but I remember it was like November, December, and they decided to fire like 60 or 70 people right before Christmas. It was like right around this time. I remember thinking to myself, like, how can you rely on stability? If you're taught to go to school, get a degree, go to work, and that's stable, when a company can just lay you off at any point, then that's not really stability. I'd rather, focus on myself and risk myself, right? And bet on myself. So that's kind of like the approach that we've always had. Is like, okay, listen, instead of doing this for someone else, let's just do it for ourselves, right? At least we kind of control our own destiny. So I think that the one thing I would tell anybody is believe in yourself, right? Find the thing that you're passionate about. And as cliche as it sounds, find the thing that you're passionate about and it don't seem like work. When I talk to people and I'm like, hey, I've been doing this for 20 years. They're like, what, 20 years? I'm like, oh, holy, 20 years passed by that quick. I haven't even realized it, right? So find the thing that you're passionate about and believe in yourself.
So where do you see yourself going now? Do you think, you said you want to expand out of Florida? So where in Florida are you? Are you specifically in South Florida, or you are all over the state?
So today our corporate office is in South Florida, but we do have reach throughout the state of Florida. We do cover pretty much the entire state. Like I said, we have 8 brick and mortar clinics, but 12 mobile clinics. We probably would have had 20 if it wasn't for COVID and some of the
and the brick and mortar places are where? Are they all over the state as well?
Correct. We're planning from Orlando, Tampa, Palm Bay, Broward County, Dade County, Palm Beach, pretty much covered the gambit. I think for 2022, we're projected to open up maybe 5 additional brick and mortar locations and another 10 or 12 mobile units. Again, like I mentioned, the mobile units are the ones who kind of go out into the community. So the goal is to go nationwide. There are other communities throughout the country, obviously, that have the same healthcare disparities and the same issues that we have here in South Florida. So we've kind of mastered the approach and the outreach in those communities. So we know that we can duplicate this nationwide in certain areas. So we have been talking to the Department of Health in some states and how to deploy kind of our plan in some of these different states. So so we definitely have some goals in mind and going to some other communities throughout the country that we know, Georgia, Ohio, some different places that we've been having conversations with that we know that we can make.
How big is your current staff, and would you consider franchising if that's something that you think you might do?
So today, if I remember correctly, I think we're down. I think we have about 90 employees, maybe 90 or so employees.
So it's a lean operation.
Yeah, it's pretty lean. 90 employees. We have franchising. I don't know if we want to franchise. Cliff and I have spoken a couple of times about opening up multiple locations and bringing on partners. The one thing that we figured out when we were working with other pharmacists and trying to work with other clinics, everybody doesn't have the vision that you have. And unfortunate in healthcare, like I said in the beginning of the conversation, it's more finance than it is health. So a lot of times it's bottom line driven, and we're not like that. So when you start talking to bigger health systems and they're always about, hey, what's the bottom line? Why are you servicing homeless people? They don't have insurance. I mean, that's what people tell us all the time. How do you make money? You're not charging people. We're like, listen, it's okay. You can actually provide free healthcare to people and still make a profit. I just, I'm not going to be Jeff Bezos overnight, but I know I'm still making an impact in the community. So I don't know about the franchise model as much. I think we'd rather just kind of do it on our own, so that way we don't have to hear anybody telling us that we can't continue providing the free healthcare.
And that's a real concern, and so I'm glad you brought that up too, because I do know, and I won't mention their names, but they either had bigger partners or corporate partners, and the brand is just very different. Because they had the same idea. It's like, how are you making money if you're putting all of this stuff in your, you've got to reduce the product, or you've got to reduce the amount of, X, Y, and Z that you're offering. And so you all feel really strongly about what you're offering and how you're going to continue to offer it, obviously.
Right. Yeah. I'm gonna be honest, like something as simple as, because I'm operations and I'm a numbers guy, right? So one of the things that we do with all of our clinics, we provide, obviously we give, water, we give snacks and stuff when people kind of come in, because we know a lot of the people are transient. So we have little lunch bags and try to give little stuff. So like just looking at the numbers simply, I don't want to talk numbers, but we could probably net an additional 150,000 just by eliminating that, right? So I know that a corporate, person will come in and say, hey, listen, we want to increase our bottom line. No more water at any of the clinics, no more coffee, no more water, no more snacks. I'm like, no, we're not doing that. You know what I mean? So things like that I know that if you're just looking from the outside and just looking at numbers, what's important to us, someone would be like, hey, no, we're not doing that. We're not doing that. We're going to increase our bottom line. No longer free healthcare, no free antibiotics. We're not doing any of this free stuff. You know what I mean? So for us, I think that we want to stay true to our mission. And why we got into this is because we wanted to provide services to those that were, being forgotten, right? And educate them. So franchising changes that a little bit. We've had offers of people come try to buy us, and it just wasn't right. We want somebody who feels the same way that we feel and want to make sure we continue doing what we're doing.
Right. Just list off some of the services that you offer, and do you think that you'll be expanding on any of the services so far, or do you think you're pretty comprehensive in what you do?
So today we do free HIV, hepatitis C, STD testing. Beyond that, we help people get insurance. We do transportation. We do prioritizations. We help with a lot of this. We help with housing. So there's a lot of kind of socioeconomic stuff that we do as it relates to getting healthcare done. The medical services itself, we don't plan on expanding outside of that, and primarily because we want to stick to what we know. We try not to boil the ocean, like Cliff like to say a lot. We want to just kind of stick to what we know, and it helps us become partners and affiliates with other clinics, so they don't think of us as competition. So I can go to a primary care doctor, or I can go to a gastro or different modalities and tell them, hey, let me deal with your difficult patients for you, right? So let me just focus on the difficult patients, and you continue doing what you do, because we want to seem as if we're competing with the other franchise clinics out there, because we're not, right? We want to deal with the most difficult patients. The patients that you don't want to deal with, send them to us. So I think that we just want to master what we do a little bit better, and maybe implement some other medical services that we know that our patients would deal with. Like I said, a lot of our patients have comorbidities like mental health. So we may want to eventually maybe bring that in-house, but until no time soon. Right now, we just kind of want to master what we do best and just do that until, we get our nationwide thing going, and maybe we'll bring another modality.
Okay. Well, I want to thank you for sharing your story and your inspiration with the audience. You're a great example that you can do good and do well at the same time. And I hope that you are inspiring just people. Well, I know you're inspiring people daily, but I'm sure you're going to be inspiring some of our listeners that if they want to go into the healthcare industry or if they want to go into social services, that it's possible to create a whole different paradigm for yourself if you're in touch with your communities the way you all have been. So Steve, where can we find you or follow you or visit you?
Yes. So for more information, you can go to imghealthclinic.com, or you could follow us on any social media handle at IMG Health Clinic.
Thank you for coming and sharing. And we look forward to having you back as you grow and to hear all the other great things that we know you'll be doing.
Absolutely. Thank you so much.
Okay.
It was a pleasure.
Take care. Thank you all for listening, and we'll see you again next week. Take care.
The Business First podcast is hosted and produced by Sonia Aline. Associate producer, Ariel Mancibo. Executive producer, Ken Johnson. Find the Business First podcast on Apple Podcasts, Stitcher, Spotify, Amazon Music, iHeartRadio, or wherever you get your podcasts. And on social at business_first_podcast on IG. The Business First podcast is a Mean Old Line Media production.